The Trump administration has already had a significant impact on how the U.S. implements public health policies domestically and on a global scale. A flurry of executive orders have presented new challenges for journalists covering public health policy, especially as some traditional sources of vital information have become unavailable in wide swaths or made more difficult to access. And yet, as our guest speaker will share in just a few minutes, public health has always been political. There are lessons to be learned from the past several months of covering public health policy, just as with the last several decades. Few understand that better than Julie Rovner. Julie is the chief Washington correspondent at KFF Health News, where she hosts the weekly health policy news podcast, What the Health. Previously, she spent 16 years as a health policy correspondent for NPR, where she helped lead the network's coverage of the passage and implementation of the Affordable Care Act, which is, of course, very timely. We'll discuss that a bit today. She's the author of the critically praised reference book, Healthcare Politics and Policy, A to Z, now in its third edition. In 2005, she received the National Press Foundation's Everett McKinley Dirksen Award for Distinguished Reporting of Congress. Before working at NPR, Julie, a University of Michigan graduate, covered health policy for national journals Congress Daily and for Congressional Quarterly, among other outlets. Julie, thank you so much for being here and for sharing your journalism expertise with us. I'll hand it over to you for your remarks, and afterward, I'll jump back in for our questions.
Great. Thank you so much. I'm so excited to be here. As Elliot mentioned, I am the Chief Washington correspondent for KFF Health News. We are the journalistic arm of KFF, formerly the Kaiser Family Foundation. We changed our name a couple of years ago because we are not and never were associated with Kaiser Permanente. So please call us KFF Health News. People call us Kaiser Family Foundation Health News, which is even more wordy than it used to be. We were Kaiser Health News. I want to start by saying I've been covering health policy, including public health policy, in Washington since 1986, and this year is by far different from any other that I have ever covered. My goal here today is to provide you with some context to help you deal with these unprecedented times in health policy and in journalism. I'm going to lay out some concepts, and then we will open it up to your questions. So without further ado, here are my 10 things to know about covering public health policy in 2025. First, and I know most of you know this, but not everybody does, public health is not the same as healthcare. Healthcare is about care for an individual. Public health is about care for an entire community. It includes not just doctors and nurses, but also epidemiologists, statisticians, social workers, engineers, researchers, teachers, and community workers. Here's the CDC Foundation's definition of public health. Quote, "Public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious disease." End of quote. Obviously, things like chronic and communicable diseases fall under the public health umbrella, but so do things like gun violence, climate change, housing, nutrition, and education. Covering public health as a reporter means covering things that affect the health of society as a whole, or basically, as I like to say, health is everything. So, number two, public health is basically invisible when it's doing its job. This is one of the big ironies about public health and something that I know drives public health professionals up the wall. We assume when we turn on the faucet that our water will be safe to drink, that our milk and meat and vegetables will be safe to eat, and that drugs, both over the counter and prescription, will contain what their labels say they are and be both safe and effective. It's only when these things don't happen that we actually start to notice public health. One of the big reasons that's so frustrating is that we as a society don't tend to fund things that don't attract a lot of attention. There's no for-profit public health, so it doesn't have anybody pushing its message to earn money. There's not, paid ads on social media or on TV. And for other communally funded activities, it's easier to see when they need more money. Roads get potholes, student test scores drop, but it's usually not until there's some kind of an emergency that we notice that we have chronically underfunded our public health infrastructure. So, three, public health is carried out and regulated at every level of government. Defense is a federal responsibility, education primarily a state one, and zoning usually happens at a local level. But public health happens at every level of government. When it's working, state, federal, and local health departments cooperate and act as force multipliers. When they disagree, well, you saw that pretty much what happened with COVID, which was clearly not public health's best moment. Number 4, at the federal level, public health is carried out mostly, but not exclusively, by the United States Public Health Service. I've spent most of my career covering federal health programs, so I'm most familiar with the work of the U.S. Public Health Service, which originally dates back to 1798. That is not a typo, 1798. Today, it consists of 10 of the 13 operating divisions of the Department of Health and Human Services, including such well-known entities as the National Institutes of Health, Food and Drug Administration, and the Centers for Disease Control and Prevention, but also the smaller Agency for Toxic Substances and Disease Registry, and the newer Advanced Research Project Agency for Health, ARPA-H, and the Administration for Strategic Preparedness and Response. As I mentioned earlier, though, public health goes well beyond traditional health and human services. So the federal oversight of public health also extends to agencies such as the Environmental Protection Agency, the Agriculture Department, and the Consumer Product Safety Commission, just to name a few. There is a long list of others that include some sort of public health authority. Number 5, public health funding tends to ebb and flow pretty dramatically. As I pointed out earlier, funding for public health depends largely on how visible it is. After 9/11 and the subsequent anthrax attacks, public health grabbed a huge amount of attention at the federal, state, and local level and got rewarded with big infusions of cash. The 2010 Affordable Care Act also created a giant pool of money for public health and prevention called, surprisingly, the Prevention and Public Health Fund. But in the case of the post-9/11 funding, that was mostly a one-time infusion of cash that was allowed to basically peter out. And the big federal fund that was part of the Affordable Care Act, which was created, quote, to provide expanded and sustained national investments in prevention and public health, was eventually used as kind of a piggy bank to fund other more emergent needs and allowed pretty much to dwindle. It's still there, but it's kind of a shadow of what lawmakers, I think, hoped it would be when they created it in 2010. Number 6, public health has always been political. Long-standing tensions between the good of the many and the good of the few or of individuals have prevailed over many, many generations. Those who think that controversy over public health began during COVID have not read their history. There have been fights in the U.S. over public health policy since before the beginning of the nation. Some of the first were over the efficacy of the then original smallpox vaccine in New England in the late 1700s. And one of George Washington's most controversial orders of the Revolutionary War was to require smallpox immunizations for his troops. So we've been fighting about mandatory vaccines as long as there have been vaccines. The post-World War I influenza pandemic caused huge fights about masking. That sounds familiar. Quarantines, and spawned some pretty wild conspiracy theories, including that it was a biological weapon spread by German submarines. They didn't even have social media, and these things got around. And it's not just contagious disease. Public health efforts have often been bitterly fought by those who would disproportionately have to pay for them or could lose profits. Think cigarette companies fighting smoking bans, gun makers fighting gun restrictions, and food companies fighting junk food taxes, just to name a couple. The list is long, and I could continue. Number 7, the COVID pandemic illuminated the very best and the very worst of public health. Obviously, some amazing things happened during COVID. We got a working and remarkably safe vaccine in a matter of months that nearly all the experts thought would take years at best. Some of us discovered we worked better from home and cut out or cut down on commuting and the public health risks in pollution and accidents that entails. And a lot of us got a good idea of what public health actually does and why it's important. Of course, COVID also, as we know, brought out the worst of public health. It helped to undermine trust in health professionals at all levels. The inability of public health professionals to effectively communicate what they did and didn't know as the pandemic ground on, I think, was a big contributor to that. COVID also provided an unprecedented opportunity for scammers and conspiracy theorists and troublemakers seeking attention to exploit the continuing tension between the rights of individuals to bodily autonomy and our individual responsibility to other members of our communities. We are still reaping the damage from this, and obviously, every day that passes, we're still seeing it play out. Number 8, public health stories are everywhere. The good news for journalists is that public health stories are literally in everything that you do. Almost every beat, the economy, tech, labor, education, even entertainment at the local, state, and national levels have a public health element to them. Restaurant food safety, school playgrounds, zoning, all have public health angles. Use your imagination. 9, public health is likely to be a major victim of the ongoing war on expertise. Public health is also likely to remain in the news for the immediate future. Health and Human Services Secretary Robert F. Kennedy Jr.'s Make America Healthy Again movement depends on a lot of things that have high public approval, but are likely to face institutional resistance. Things like reducing drug advertising and ultra-processed foods in our diet, but also things that have dubious or no scientific evidence to support them, including people peddling supplements that may do no good or in some cases cause actual harm. And we're already seeing this administration trying to disappear information it doesn't agree with and force longtime career professionals out of government service, taking their expertise with them. The list of stories is literally endless. Every week on our podcast, I have to jettison at least a third of my rundown because there is simply not enough time to mention everything that's happening every single week. And number 10, finally, there are lots of organizations that can help you cover public health. The last bit of good news is that there are places you can go for help. Every state and city and county has a health department for which part of its mission is to communicate with the public. Most states have one or multiple schools of public health with lots of people who are happy to explain things. That's what they do for a living. You can find them through the Association of Schools and Programs of Public Health. The Association of State and Territorial Health Officials, known as ASTO, is the umbrella agency for state health directors, while the American Public Health Association and the Trust for America's Health are national organizations that publish journals and reports and can usually find someone for you to talk to. It's a great time to be a health reporter. I promise you will never run out of things to cover.
Julie, thank you so much for those helpful insights and for ending on an encouraging note there. A reminder to our audience that you can share questions in the chat or using the Q&A function at the bottom of your screen, and I'll monitor those and send them your way, Julie. I want to start, though, with a quick question about your podcast. I'm wondering if you can give us a bit of a window into your process. It comes out every week, but sometimes you have special episodes and obviously have to pivot if there's something very timely, like a confirmation hearing or important vote. How far in advance do you plan those episodes? And when you have to switch gears, especially under the current administration, what are your first
Yeah, there's a
steps?
lot
Where do you
of
go?
gear switching. We're trying to do, I mean, the general sort of theme of the podcast is the health policy news of the week. And usually, but not always, an interview with a newsmaker or somebody interesting, or, sometimes I have a theme that goes on. I start Monday morning. I get up and sort of, if anything I might have missed over the weekend, I have a running list of topics for that week's podcast. And, sometimes I will jettison things and say, just put them to the next week. I have this like 100-page document that I switch up every 6 months with everything that we've talked about and everything that we're going to talk about. I have a panel of 15 all women health policy journalists that we started that way, and we have maintained it. So every Monday morning I send out a note like, who wants to podcast this week? And I see who I get. And sometimes I get people with specialties that it's like, oh, that's the good week to talk about X issue. Although right now there's just so much news. And I spend a couple of hours every day, Monday and Tuesday, updating my rundown. Here's something that happened. Here's something else that happened. Here's something that I know is going to happen. Here's the Supreme Court hearing that's coming up next week that we should talk about this week. And on Wednesday morning, I kind of finalize the rundown and I send it out to the panelists. And I spend Wednesday afternoon writing the script. And I used to print the script out on Wednesday nights and we tape Thursday mornings. And I don't anymore because now I get up on Thursday morning and I revise things again because usually there's news that's broken overnight. The interviews we do separately, usually a day or two before. I used to do them like a couple of days before, but things change so fast that now we don't really, I try to do them on Tuesday or Wednesday, and then we tape the podcast Thursday, and we get it up Thursday afternoon. I mean, we try to get it up within a couple of hours of when we tape it. Obviously, we still miss news. That happens right now. We do the best we can to try and keep things as up to date as we can, but it's like, there's always next week's podcast where we will catch up on it. When news is slow, and gee, once upon a time, there used to be weeks when news was
Right.
slow.
Hmm.
I like to do sort of single issue episodes. We actually did one last fall um, on public health. We did one also last fall on health equity. I've done sort of explainers on Medicare and Medicaid and prescription drug prices. I use some of the interviews to do explainers too, but sometimes we'll have an all about Medicare. It's probably time to do that again when we should do another all about Medicaid. A lot of our listeners are assigned by our students who are assigned to listen by their professors. So I feel like I'm sort of an adjunct I speak to a lot of different, and it's health policy classes and public health classes and medical school classes and nursing school classes. I mean, I get people, sort of in all facets of the healthcare system, who'll come up and say, "Oh yeah, I listened to your podcast." Sort of anybody who wants to have anything to do with healthcare policy writ large is probably a good candidate to listen to the podcast.
That's great. And I just love that you have a 15-person panel, all women. That's incredible. I'm curious if you built that over time, if that's something that, kind of built organically through connections. Yeah.
Both. But I mean, I do
Both.
it because obviously when there's news, when Congress is in and it's busy, people, it's hard to get, we try to have four people. We sometimes do it with three. And everybody's running around covering things, but that's why I want this panel. These are people who are covering these things on a day-to-day basis and, and can add stuff that is not in the background reading that I'm doing or even the reporting that I'm doing. And they sort of bring this to the table. And frankly, I built the podcast because it used to be when I was on the Hill and we would stand outside of closed meetings. The reporters would sort of talk amongst each other and we would learn from each other. It's like, oh, I didn't know that person knew this, or like, oh, you found that. And, and it wasn't so much, you kept your scoops to yourself, but it was health reporters have always been really good at sharing information, which makes everybody's stories better. And I feel like we're bringing that conversation to a wider audience. That's basically what the news part of the podcast does. These are the conversations we have at cocktail parties. Sorry, health nerds are really boring.
We have a great question about false statements and trust in health information. How do you manage addressing false health statements or conspiracy theories that are relevant to a story without providing it a platform to help it circulate? It's a great question.
It's hard. We've spent a lot of time, particularly during the pandemic, talking about this very subject. We have a new program here at KFF on healthcare misinformation. I've spent a lot of time. It's like, yeah, how do you, the whole truth sandwich? You say what the truth is and what the false thing is, and then what the truth is again. It is difficult, but I do feel like a big part of my job is to help people trust that the information that I'm bringing them is true to the best of my knowledge, and that I have a lot of tools that I can bring to ensuring that that is true. I'm always very careful to say, I am a policy reporter. I am not a medical reporter. I don't have any medical expertise. I have a lot of policy expertise though. So I don't try to oversell my own qualifications, but it is, it's really frustrating to see basically everybody looks the same on social media and they come with the same, they seem to come with the same amount of, uh, everything looks like it's all been checked out to the same extent when obviously that is not true.
Absolutely. Someone else put in the Q&A a freelancer who often writes about health policy. Like everyone, they've had trouble adjusting to the post-January 20 world. News moves so fast. It said, I have my contacts in various agencies, but most of what they consider scandalous is just matter of fact. The most shocking things are just public knowledge. It's difficult to find a story no one else has covered that would make a good non-breaking news story. Any advice? And thanks for doing this.
Like I said, go a little further afield. I mean, there are stories for everybody right now. I mean, I think that I, I identify with the idea that things are happening so fast, particularly for a freelancer. I freelanced for several years. It's hard to do something and, and sell it and do it and get it edited and get it out before everything changes or before seven other people have discovered the same story. I mean, that's a huge challenge right now, getting the news out before others do. Unless you happen to get added to somebody's text chain by accident. Uh, Never happened
Right.
to me.
Not on Signal,
Yeah,
unfortunately.
nonsense. But I mean, it is hard right now I was early on in February, I was assigned a fairly typical story about, what's Congress going to do about PEPFAR? And I'm getting ready to sort of launch into this story about what Congress is going to do about PEPFAR. In the meantime, Elon Musk is taking PEPFAR apart. There is no more PEPFAR. So it's like that story is kind of a non-story at this point because to some extent, if Congress wanted to reauthorize PEPFAR, they would have to basically recreate it at this point.
Hmm.
So, things that seem that in a normal course of Washington reportage would seem, oh, you've got a week or two to work on this. Sometimes you have an hour and the whole thing changes. It is really hard. It's really challenging right now.
Julie, you mentioned in your points that it's not until something goes wrong often that we notice public health and the systems that are at play. I'm just curious, how do you stay ahead of public health policy or on top of it? You can't necessarily wait for something to go wrong to start reporting to, be on top of these things. So are you connecting with sources on background regularly? What are your avenues of finding information before something goes wrong?
People send me stuff, which is nice. I mean, that's the nice thing about being a beat reporter is that people send you stuff. Um, I used to spend most of my time on Capitol Hill because Congress used to actually do its job. And then I would find out things being on Capitol Hill. They would have hearings about programs that needed to be reauthorized. They would reauthorize programs. They would have debates about policy when they would reauthorize programs because they would decide what to keep and what to change and what to jettison. And you would sort of watch the sausage being made. It all used to happen basically in public. Um, that that was a huge source of stories for me. I tend to like trend stories. I'll sort of see
Mm.
things together and then put the pieces together, say, this is what's happening. That's just me. Every reporter has sort of the things that sort of attract them to a story. But I will say, because Congress is basically, I won't say abdicated its job. Congress isn't really doing its job right now. They're not doing anything. That as a source of places to get stories is difficult. But obviously there are still advocacy groups on every side of every issue who are pushing things. Although I confess with things happening so fast, there are people sending me, sort of typical Washington press releases, and I just sort of, look up and roll my eyes and say, read the room, people. This is not a story right now.
Hmm. We have a question from Legia. Why have journalists not been more critical of government policy and messaging toward the continuing COVID pandemic, say, since 2022? I'm thinking, for example, of how the vast majority of reporters speak of COVID and the pandemic in past sense, when per the World Health Organization, the pandemic's never ended.
Yeah, I mean, it's hard to know. I feel like people, read editors, have wanted to move on from the pandemic. That's part of it. They don't editors don't want to greenlight a lot of stories about the pandemic because it's considered old news, and also because that's not what people want to read about or hear about. There's still a lot of really important pandemic stories. We have bird flu floating around that's threatening to cause another pandemic. I mean, I'm amazed at, how people are able to just kind of compartmentalize that impending threat. It's, some of it though is there's an extent to which journalism is giving readers, listeners, watchers, the audience what it wants. It's not all about clicks. Luckily, we are a nonprofit, so we don't have to worry about clicks, but we do want to, we work with a lot of other media partners. We want the stories that they want. It's there are a lot of that. It's like public health, and when it's not right in the news, nobody cares about it. And I feel like that's
Mm.
kind of true of COVID right now.
Yeah, absolutely. We have time for maybe two or three more questions. We have one following up on the previous great question about the new news environment. How do you deal with overwhelm when you're getting lots of different info from lots of different sources?
um, you try to sort it out. Sometimes you take a pencil and a piece of paper and you try to got this and this and this. I mean, I'm very old school about some of these things. Having done this for 40 years, I do the best I can. I try to figure out what's going on and explain that to my audience, whether it's a print audience or an audio audience or whatever. And depending on what the audience wants to know, my mom was a journalist. I'm a second generation journalist. I take my job extremely seriously. Healthcare is something that affects everybody. And I want people to understand enough to be able to make their own informed opinions about policy. That I feel like that is my job as a policy reporter, not to bring them my opinion, not to make decisions for them, to give them the sides that they need to make an informed decision.
I love that reminder of coming back to the basics of explaining what is happening. Um, we have a few questions actually in the Q&A, which is great. So someone is a public radio reporter in Georgia, and they found it much harder now to get sources to comment on, for example, what cuts to public health could mean, or some of the results we're already seeing on a local level. Any advice for navigating an environment that could be increasingly difficult for sourcing? Public health can already be so hard to navigate, for example, patient privacy and HIPAA.
It is, and I think this is part of the continuing war on expertise is also a war on the media, and people just don't believe the media. People don't feel like they need to talk to reporters anymore because they don't know who you are and they don't know, what you might do with this information. And plus, everybody can say they're a reporter, which also happens. It is hard. It's a continuing challenge. As I said, there are a lot of national organizations that can help you find people on the ground where you live. That's a good way when you can't get local people to talk to you. It's to sort of go around them and try, because there are obviously, I mean, one thing we're seeing about, all these town meetings, people are paying attention right now
Mm.
and they are up in arms. And it's a good time to, I think right sort of this minute is a good time to get people to talk. I think people are more eager to, but yes, I'm well aware that, as official sources, people are afraid to talk, people are afraid to give bad news, or people just have been told they don't need to interact with the media.
Unfortunately, right.
Um, I recognize the challenge.
Mhm. Another question from the Q&A. While there are a lot of breaking news moments in this public health environment at the federal level, is there anything you suggest for reporters, particularly on the local level, to follow for second day and long-term stories?
Yeah, I mean that's the nice thing about public health. It's happening everywhere. If you look at Health Beat, which is our partnered public health vertical, we have lots of both. We have local and state stories. It's early in the year. A lot of state legislatures are meeting this year. A lot of public health happens in the state legislature. Public health happens in town meetings and county council meetings and city council meetings. And when I was at the University of Michigan, I covered the Ann Arbor City Council. That was invaluable experience. You'd be surprised what you can find out just kind of walking around your local town hall. They're in neighborhood listservs. People bring up things that are basic. Do you have a dog bite problem? That's a public health issue. Traffic issues are public health issues. I mean, there literally are stories everywhere.
Definitely. And Amanda asked in the chat, where do you spend most of your time now as a health policy reporter in DC? That's something Amanda struggles with, especially given that the new administration has been very closed off to the press.
Yeah, what this and this is yes, this administration has been very close off the press in, as I said, unprecedented ways. But this has been happening over the last several administrations, Democrat and Republican, over since I've been sort of working at this. It's been harder and harder to get people in the administration to talk to you. That information that goes to reporters is more and more centralized out of the White House, and not out of the Department of Health and Human Services. That's just been a trend, sort of as the presidency has gotten more powerful, the communications lines have gotten narrower. It just is. So, like I say, I talk to, I have having been here as long as I have, I know lots of people who are in law firms and lobbying firms and, former Hill staff and at advocacy organizations, around Washington and around the country. And I sort of, rely on them. And, I don't, as I say, I don't spend as much time on the Hill as I used to, but if you can, that's a great place just to pick up intelligence. I mean, there is nothing that's more sort of, there's no place where you're going to get more quick ideas than just walking around Capitol Hill, listening to members and members of the media talking to each other. It's much freer than covering the administration. That's why I've always preferred it.
Sometimes gossip is the best way to get ideas for stories.
Gossip is often a good way to get ideas for stories.
We're
There's
gonna
a
end it.
reason you go to cocktail parties.
Absolutely. Julie, we're going to end it with one question here from Ted. Given the sometimes idiosyncratic views voiced by RFK Jr., other incoming health officials as well, do you think this administration will break with oversight policies that favor major commercial interests in food production and in pharmaceutical or device manufacturing? In other words, do you think they'll treat any types of conflict of interest differently than in the past?
I have no idea. The one advantage of my job is that I get to watch and report. Sometimes I can predict things. I can predict that the chances of these huge Medicaid cuts happening are very small because it's going to be very hard to get that through the Senate. That I know just from, but what this administration is going to do, what they're going to try to do, what they're going to not try to do, it's a huge black box, and I think we're all going to watch it together.
Most definitely. Well, Julie, thank you so much for your time, for your insights, and for answering these great questions from our audience. We'll share a link to the recording soon to all registrants, so check your inboxes by the end of today, along with resources shared during this briefing and more. The National Press Club Journalism Institute is proud to produce programs like this at no cost to journalists across the U.S. with the mission of powering strong journalism in the public interest. If you'd like to support us in this work, we hope you'll consider making a donation today. And please spare a few minutes to fill out a survey to tell us how we did today and help us improve our programming. We also hope you'll join us for the next program in this series on Tuesday, April 29th, which will focus on community health workers and how connecting with them may be the key to telling important stories about public health. For that, we'll be joined by Bashar Chow, Chief Health Officer at Kaiser Permanente, and Denise Octavia Smith, the Executive Director at the National Association of Community Health Workers. This webinar series is part of the Institute's Public Health Reporting Fellowship, which is funded by the Common Health Coalition, a network that brings together leading health organizations in pursuit of a reimagined health system in which the nation's healthcare and public health systems work hand in hand. Thank you all for joining us, and we hope that you have a great rest of your day. Thank you again, Julie.
Thank you.